Ali, you published also a guideline about the use of the PPE for during the endoscopy. Maybe you and Haru can comment. What is the appropriate use of the PPE during the upper endoscopy?
Thanks, Philip. So we did extensive research with about 40 endoscopy in the area of the most epicentric part of infection in Italy, altogether with Cesare. So we have very good data that we can share with all of you. So the first data is this. We collected data on 1,000 patients who have been scoped in the months of March in my unit. And we followed up all of them, and we made a questionnaire. We called all of them, we made a questionnaire, we asked about respiratory symptoms, fever, and eventually the use of the test. So only 8 patients out of 1,000, they got some kind of respiratory symptoms. 5 of them were tested. 3 of them were considered very mildly symptomatic, so they were not sent for the test, they were not referred for the test. And only 1 out of 8 out of 1,000 patients was tested positive. And that patient was one patient who turned out to be positive 16 days after colonoscopy. So I'm not sure that the infection was taken into the endoscopy. So the first data I want to share with you that we analyzed with Cesare, we are going to publish in GAP, it's been accepted yesterday, is that when you do endoscopy, if you follow the rule, you are protecting yourself, you are protecting your patients using properly the PPE, the risk for patients of getting the infection is very minimal, very, very minimal. The other point is that we have evaluated with Cesare is that we reported data on infection among healthcare personnel working in the endoscopy workspace, okay? Not just all of the workers in the GI department, but specifically those living and working for more than 8 hours per day in endoscopy workplace. So the rate of infection is about 4%. So we interviewed about 1,000 endoscopy personnel in more than 45 hospitals. And if you look to these data, these are almost half the rate of the infection in hospital workers in Italy. So in Italy, all professionals involved in the hospital who are COVID positive, like our hospital, we are a quarter for COVID positive patients, is about 8 to 9%. So in endoscopy, the amount of people who have been reported with the infection is 4.3. So again, if you properly use the PPE, the risk of getting infected if you are healthcare professional in endoscopy is again not that high. And the other point that we got from our research, and this is another paper that we would like to generate within today, is that we classify the hospital based on their policy with PPE. And we had a sort of retrospective randomization because 1/3 of the hospital were using only this surgical mask I'm wearing now, plus facial shield, and they were not using the N95 respirators. Those hospitals, which is about 1/3 of our cohort, were using the N95 only specifically for those patients who were known COVID positive, so very few patients. And the rest of the hospital, 2/3, they were using N95 all the time for all patients. So they had a lot of masks. They were free to use the N95, which is quite a unique situation, no? Because there is big shortage of this. And when we compared the numbers, so the number of infected people among healthcare personnel didn't not differ between the two groups. And we are talking about more than 1,500 people who were analyzed in this big cohort. So what does it mean? It's not only the mask itself, it's the multiple protections and also the way you use all that stringent measures that are going to protect you. I don't think there is only the mask. It's the mask, the facial shield, the double gloves, the water-resistant gown, the fact that you follow very strict the rule of cleaning your hands. So if you do all of these issues properly, probably the risk is the same whatever you're wearing, N95 or surgical mask.
Yes.
Yes.
Yes. So it's a very important point. So PPE is a very, very important for us. And of course, the full caution is necessary. We have to protect, but the problem is a shortage of resources. That's a problem. So we have to control the in between. So of course, guideline and the recommendation is a full caution of a PPE is a very important. But the actually, when we perform the endoscopy, so at the time, so not always PPE not enough. So that's the problem. If we change, so everything in each case, we have a shortage of the PPE. So how is the situation in Hong Kong?
Yeah, I think I fully agree. So we established our guidelines. So inside our endoscopy center. So for a session, we have a limited number of endoscopists and nurses. So just the most experienced endoscopists, 1 and also 2 nurses will be doing the whole session. They would probably be, we adopt the policy of a conservative use of the PPE. So if there is any need or contamination of the gown, we will change it. But for the mask, we recommend just to wear 1 mask for the whole session, because as Ali mentioned, it's not only about the PPE, but the whole infection control process, which is important. So every time if we change, we also expose ourselves to a risk of transmission of the virus, because we don't know whether our gown or our mask is being contaminated. So we need to follow a strict rule of changing the PPE as well. So that is also what we learned from the SARS period.
Also, probably it is included in a statement, but it is very important to, training or, instruction how to, wearing a mask or every PPE, and not only endoscopy, but also nurses and also every staff who is cleaning the endoscopy room, or everyone, they have to be well trained. I think that is very important, or more emphasized.
So Noriya, I think you have prepared something. Do you want to make some presentation for us?
No, I just a summary, so I think it's okay.
Yes.
Yeah.
Okay.
Yeah.
I want to add 2 points to the discussion. So first, N95. There was a very nice meta-analysis in the pre-COVID area showing no superiority of N95 over surgical mask for virus infection. And the main reason attributed by the authors was that not all healthcare personnel know how to wear properly the N95. So I agree with Noriya that the training in use of PPE is extremely important. Why? Because self-perception of the healthcare personnel in how to use PPE is completely misleading. People who feel to be extremely good in how to wear PPE are actually very bad. For this reason, it's always good that 2 persons cooperate in downing and doffing in order to correct possible mistake that may happen.